Welcome to all those who are logged in. And tonight we're going to have the discussion focus around the impact of micro-osseous perforations and high-frequency vibration. A couple different techniques to help in the acceleration of orthodontic movement. And that'll kind of be the direction of our discussion. Obviously, we'll discuss a little bit specifically on how we implement that with certain orthodontic treatments, whether it's traditional braces or Invisalign. And in our practice, we provide both. So you'll see a little bit of that tied in with the discussion tonight. Goals are, setting some goals for this discussion. I'd like to obviously make the case for those that are maybe new to this acceleration method or kind of are on the fence about it, be able to think through clinically what is going to be the best options for you and how to really make the difference clinically for your patient. And then also thinking from a patient perspective, how do we communicate to our patients in a way that gives them confidence in our ability to give them an acceleration treatment that really delivers something unique to them. And then the advanced implementation of Propel. So thinking about how we can use it in multiple methods, whether it's setting the stage for implant placement or allowing our patient to have an amazing cosmetic result with some veneers in the end because we decided to implement an acceleration process to our orthodontic movement. So moving forward here, I just want to, before we get too far in, I want to make sure that we, if you're going to have to listen to me for a full hour, you're going to definitely want to get some CE. So make sure that you go ahead. Sorry there. Sorry, I was on the wrong screen there. So go ahead and make sure that you sign in and sign out on the attendance sheet to qualify for the CE. And as a little disclosure here before we get started, I want to let you know that I am not employed by or have any invested interest or in a corporate dental company. I own a private dental practice and serve as a consultant for the products I use, and I appreciate the benefits of them in my own practice. A little bit of who you're listening to tonight. This is Dr. Greene Olsen. I attended UMKC School of Dentistry in 2007 to 2011. There you can see my family, my lovely family. I've got Riley there, who I'm holding. He's 2.5-year-old. He's my baby boy. Loves to do everything and mimic everything I do. A lot of fun with him. And you'll see Gabby and Hallie. Gabby just recently started playing basketball, so kind of fun. Mom finally let that happen, so that was exciting. And then that's my wife and Hallie on the lower right there. So if I wasn't doing dentistry, I can assure you I would be barbecuing. So that is my passion. I love barbecue. If anybody out there, I can't hear you, but I'm sure if you like barbecue, we're at the same heart here. I love brisket, ribs, pulled pork, anything low and slow. It's a lot of fun for me to do that. So I love to create relationships with the patients, just like you all, I'm sure. And I love incorporating the latest in dental techniques to improve their experience. And it's a lot of fun investing in a team and helping amaze our patients and achieve their best. So those are some of the things that really excite me. Just like you all, you have a team that helps you create these experiences for your patient. And I want to obviously recognize the team that works with me every day and allows me to do what I love. And there is our mission statement. Our passion is to create brighter smiles through innovation. And at the core of what we do, we want to really have a passion for it. And you can see all these people, hopefully the emotion comes out, they're passionate about what they do, and it's a lot of fun to work with them and change lives with smiles. And on the lower left, you can see something that's kind of unique and it's kind of an innovation in our practice is an outdoor waiting area. So we have a lot of these different ideas that we think up and try to implement and create something unique. But there's one of those, our patients that are waiting for their same-day crowns, or while their son or daughter is getting their braces, wire changed or anything like that, they can go out there and enjoy a beverage and sit outside by a fire. We have a little fire pit, and so kind of fun to do that. Kind of a wow thing that gives some excitement to the experience. There you can also see our reception desk there at the bottom. And on the lower right, I thought that was a fun picture. I drove up to the office probably a week or two ago and saw the sun rising behind our office, and I thought, that's pretty cool. I got to get a picture of that. And I laughed because it's like God's parting the skies above Innovative Dental. So that was a great way to start the day. So my why and kind of what makes me tick, I think that'll give you some perspective into our discussion tonight. You know, I think about the decisions of which technologies, which techniques to use as more a focus on, is it going to improve the patient experience, and is it going to be something really exciting for me to do? And you know, there's obviously a financial component to these decisions, but ultimately you gotta, most of us have to work, and why not do something we really love and are passionate about? And so that really is guiding the decision of why you might want to, you know, introduce Propel. Yeah, with anything new and anything that's going to be a different learning curve, there's some things to think and consider. And I think that one of the best things is to align yourself with making decisions that really reflect how much it's going to impact our patient experience and their excitement for what we're able to provide. And some of those things that, you know, kind of I list here are what we want to be known for. You know, our patient and practice benefits to our community. We want to be known as a cutting edge technology business where we are not afraid to really learn and invest in things that are new. And we want them to be impactful for multiple different treatments. And what's cool about you know, MOPS, and I'll get into that a little bit here in a minute, is we want to really discuss and figure out ways that we are able to impact multiple areas of care. So it's not just braces, not just aligners, but we're able to create better spacing for implant restorations, and we're able to, you know, rotate a tooth correctly and get it in the proper position before we do veneers, so we don't risk endodontic therapy being needed to finish that treatment. So those are things that I think in the past were big hurdles to our patients' quality of care, and now we're able to really change that by encouraging them to do treatment in 3, 4, or 5 months, and now we're able to really unlock a smile in a different way for them. So obviously that gets into something that is going to set you apart from the rest. And so I feel like you're able to market in a way that differentiates your practice and really sets you apart from others that are maybe not comfortable investing and learning as a frequent thing. And obviously those who are listening tonight are all kind of trying to always grasp that. So that's inspiring. One thing about faster treatment times, and you all know this, but it is one of those biggest hurdles that we're going to face with patients accepting treatment. And it's going to attract new patients when you can complete treatment in an accelerated way. It's going to obviously make a difference in their compliance. I can speak for myself, being an Invisalign patient, when you can see and feel results happening in days rather than weeks and months, you get an excitement about the care, and you can kind of see the end before you get there much quicker, and kind of feel that. And that's really where patients get excited. They come in for their checkups and they're going, man, I can already see a difference. We pull up the photos, and we're doing these type of visits within a month, not you know, 3, 4, 5 months down the road. So that's pretty amazing. And then the area where it may make the biggest difference for your bottom line immediately is you'll notice the decrease in chair time. So you'll find that with treatment being accelerated, you're going to need less visits in order to get the treatment done. And what does that do? Obviously, it opens up production opportunities for your practice, opportunities for you to really do some other dentistry. Now we've kind of got the why lines out. You kind of know who I am. I'm going to lay out some of the issues, or some of the thoughts of the science behind why acceleration and how acceleration works, which if you're like me, it takes me a little bit back to molecular cell biology, and I get a little bit of a fever and a little itchy, and it kind of makes me shake a little bit. I don't know if you guys remember reading through the book and seeing those diagrams and things, but we'll show you a few of those and go back to that a little bit. And then after the science, we'll show a little bit of the methods of how to implement Propel in the practice, and then we'll have some areas where a discussion about the exact steps in our practice, how we use it with Invisalign. Have a little video that I'll show you of Propel being performed on myself, And then we'll finish it off with something I think is pretty interesting. It'll be the clinical before and after photos and a discussion of time frames. So you can see from a perspective of what does this really mean and what do the cases look like, what are the time frames, what are the tray change periods, what kind of acceleration results are we really getting when we start stimulating the bone to heal at a faster rate. So let's go ahead and dive into the science here. So the science, first I want you to know that this idea of perforating a bone and having a healing response initiated from that is not a new idea. It's a technology that's really been around for, from what I understand in my research, it's been decades. So you're talking about orthopedic medicine kind of figuring this out a long time ago. They knew that there was a benefit here to basically stimulating injury to a site around a fracture, and as you could probably guess, what drives a lot of decisions would be high dollar athletes. And so you have an athlete that breaks a bone and has a $2, $3, $4 million contract and is unable to play. What kind of detriment that might be for their team? And so there's a lot of motivation to get that player back on the field quickly and safely. And Propel, or the micro-osseous perforation technique, has been shown to be very effective in this. So you're going to increase, and here's how it kind of does that. We'll discuss the kind of the method of this. So you create injury and inflammation, and with this you get the cytokines production, and then this will increase the rate of bone remodeling, and thus leading to decreasing the bone density. And that decrease in bone density is ultimately where teeth are going to move easier, more predictably, less pain, right? What's the number one cause of pain in orthodontic movement? It's the inflammation, the pressure placed in the socket and that PDL ligament. And when we start reducing that pressure needed, we are going to reduce pain. So I can speak from experience myself, that is absolutely 100% true. So pretty cool. Here's a nice diagram that shows graphically what's happening here. So you have a tension side, you have a pressure side. So this is just basic orthodontic movement, understanding the basics of this. I'm sure this is just a recap, but you're gonna be stimulating bone remodeling by just putting the force there on, and they illustrate with that with the bracket. This is gonna cause cells to start to differentiate, right? You wanna have the osteoclasts and osteoblasts start to build and remove bone, and this is going to create a socket change, and that's where you're seeing the tooth being able to move. And if we can get that reaction more than just in the cortical plate, you can imagine the benefit to orthodontic movement, and that's what we're doing with micro-osseous perforation. Obviously, there's one other way you can move teeth quickly. You can just push them too hard, and here's an example of what you do when you do that. We've probably all seen it in our practice. It's difficult to do this with Invisalign or clear aligners, but it is fairly easy to do it. At least it seems to be with brackets. I seem to see this often in our patient base. Not as often anymore, but I have seen a number of cases where you get the foreshortening of the roots and just pushing a little bit too hard on the tooth. All right. So the next slide here, this is the one that really made me kind of get a little itchy. So if you can see these, I think there's plenty of things that we can kind of recall, but this is one where you see cells that differentiate. And this is what is awesome about Propel, is we're not getting this reaction isolated in a socket. We're getting this reaction throughout the bone. And so what you have is your pre-osteoblast turning into osteoblast from the stimulation, and it's not just happening in the cortical plate. That's the ultimate takeaway here, is that we're getting a profound amount of cell differentiation, and we're getting a lot more resorption, and thus remineralization and all the things we need for proper tooth movement. All right, so now we've got through the basics of the science. I think the science is as deep as we need. You know, when we talk to our patients, and I'll discuss that here in a minute, the simpler, the easier we make it for them to understand, the less likely you're going to have hangups with acceptance. And so that'll be part of our discussion, because I think that's it's nice for us to be able to explain it, understand it ourselves for our own benefit, and maybe encouraging our team on why we would choose to implement this. But when it comes to discussing the science with patients, because they're going to ask, I think the simpler and more confident you can give them a statement about the healing method, the more that you stimulate healing, and that being really the focus of your discussion, you're going to have a lot more success in moving forward with treatment. So these are the tools that are kind of available for acceleration, and I think that we're familiar with them, or at least most of us have heard of them. First one we'll talk about here is the vPro 5. It's a rechargeable device. It's obviously a patient-controlled device. We're dealing here with something that is the patient has total control over, we don't, and it can be a little bit of an issue in the sense that we have to rely on their compliance. But I will tell you, the easier that the device is for the patient to use, obviously the more they're going to use it. And this device is pretty darn easy. So it's a rechargeable device, it's low cost to the patient, and really you can choose to include it. I mean, there's lots of different ways to, and that's a whole other discussion about how you want to implement the costs and billing and aspects like that, and we can discuss some of those things if you have questions at the end. But we choose to include it in our office, and I can kind of explain why we do that. But it just gives them probably the best experience, and that's really what we're going for in the end. So, and you want to increase their compliance, and when they do something daily with their aligners, it kind of reminds them of what they're doing, why they're doing this, and it gives them some encouragement there. So you'll see that the aligners remain in the mouth during this the use of the vPro 5. It can be used with braces as well, so there's both options. There's 5-minute treatments per day is kind of what's recommended. One of those at least, and what we recommend 2. So we recommend 1 in the morning and 1 in the evening. The other thing that's kind of a unique phenomenon about using this vibration device is that I'm sure all of us can recall a time where we have been riding a bike or even driving a car that's not in balance, and the vibration will cause you to get a little bit numb. And so that type of feeling is what we're really getting ultimately with this low frequency, or the high frequency vibration, is the patient doesn't have nearly the discomfort, and there's a little bit of a soothing effect provided by the vPro 5 device. All right, and here we have the doctor-controlled device. So the doctor-controlled method. Micro-osseous perforation with a device that, like this Propel device here that you can see, to dimple and cause that injury in that science that we were talking about earlier. So some great benefits to this, right? First of all, it's doctor-controlled. So you have control over this. Once you do the treatment, you don't have to worry about patient compliance. And now you're talking about roughly 5-6 months worth of clinical benefit, and the patient doesn't have to do anything. So I know that we sometimes have difficulty getting our patients to floss, and so if that's where they're at, and your compliance issues, this really cuts to the chase, right? We're able to give a profound benefit to increasing treatment time, or sorry, increasing the acceleration of the tooth movement without worrying about the patient having to provide any sort of stimulus. It's micro-invasive, so I think this is probably when I've talked to a few other dentists, I think this is some of the hang-up is there's a little bit of a concern about how much am I going to hurt the patient? Am I going to damage anything? Is there going to be any long-term, and these are obviously patients' questions too, but is there going to be long-term damage to the bone? Does it heal back the same? And I can tell you with the experience of doing hundreds and hundreds of cases with Propel that I've not seen a single issue with damage or injury. So the micro-invasive nature of it is really nice. And so yeah, you're going to get some bleeding, but if you look at the dimple site, it is so small. And so you're talking about a bleeding that would end within most of the time minutes. So recovery time. So this is a little bit different when we talk about what is the recovery time with micro-osseous perforation. I don't have a canned answer for that because it does vary. And I can tell you with my experience when I've had Propel performed on myself, my healing time was super short, and I'd had next to no discomfort. I really don't think I can say I had any. My wife, who I was crazy enough to perform Propel on, she had a great experience as far as the acceleration working, but she did have some more discomfort than I had. So for about 24 to 48 hours, she was a little more sore around the sites where I propelled. So as far as recovery time, you can go back to work, but as far as discomfort, you have some variability there, but it's still very minimal. And I would say I've never had anybody really say it was very painful at all to recover from. So there's a low to no cost to patient as far as the costs there. It's a pretty low fee for the office to implement, and we choose to include it. It's a great way to make sure that we get the benefit of acceleration for our practice and our patient every time, and not have to worry about their decision to whether or not they want to accelerate treatment. There's minimal training needed. So as far as you'll see a video of me performing Propel here in just a few minutes, and you'll see how simple it is. The tactile feedback is phenomenal. And I think I would make a case for using the device that gives you the tactile feedback. I really like to know when I have crossed the cortical plate and how that feels, and when I really get a good amount of resistance, I know that we're being effective in causing that micro injury. There's multiple device options. So you'll see there's a single use, and I think that's the one here in the photo. I don't think I've used that. There's the reusable handle, which is the one I currently use. You buy the tips for, and then the power driver. I've used the power driver as well. It's a great device, well made. My only complaint or only issue in my hands was the experience of not having as much tactile feedback. And so I think that's really comes down to your clinical preference, but you won't get nearly the feedback there as you use a powered driver. And then you'll have a little bit of a difference in the speed of being able to provide the Propel treatment. With the reusable handle and going through multiple sites, it rarely takes me longer than 4 or 5 minutes to provide Propel. So here's the reusable device. You can see there's a couple options. I think you may have seen these in any of their marketing materials, but one of them is a device that has a measurement, so you can see how deep you go. And I think for as you start, that gives you a little bit of comfort. Hey, how far am I going? Am I going through the whole ridge, or where am I at in this process? And so this gives you that marking. So you can see those 3 rings there. I believe they're 3, 5, and 7 millimeters, so you can kind of get that gauge. You can get this without those rings, and as you get more comfortable, I think it's nice to be able to use that device without the rings, to just kind of tactily get that feedback in your hand and your wrist as you spin that into the cortical bone. There is next to no soft tissue impact. You'd be shocked if you've used this very long. You would know that the tissue heals across in days, and you really can't see hardly any sites after a few days. There's a proprietary tip construction, which it causes there to be the proper amount of force as you penetrate the bone. And it provides that stability, control, and I've mentioned it a number of times, that tactile feedback that I think is really valuable. This is much more time efficient than that other one, which I mentioned, the power one, and fairly inexpensive. So those are the benefits there of the doctor-controlled reusable handle device. So none of this, knowing the methods and figuring out which device and knowing how to accelerate doesn't really get us the ability to make the change in our practice for our patients to choose accelerated treatment. So really being able to nail the consultation, and I want to spend just a brief bit of time on how we use the discussion with our patients to differentiate ourselves, like I mentioned earlier, and then really answer these 2 questions, which I think patients obviously come to us with the how long is it going to take and how much is it going to cost. Those are the two hindrances that I think we're all kind of going, okay, how can we tackle these for people, lower that concern so that way they are more likely to allow us to help them. So in my experience, the ability of us as providers to build rapport, and not just us, it's really our team too. So the whole team building a confidence and rapport with the patient, you know, conversations like getting to know them and their family and what they do and what motivates them, and you know, finding out how much they've looked into what your practice does. Those are going to unlock the skill sets for your team to really get in and reassure them and tie in those type of motivational items. So what I'm getting at here is, you know, you have patients that say, you know, I've got 3 kids and they're all play sports, and you're creating this relationship, and you're basically finding somebody that you know, they work full time. You're finding somebody that has a real time issue, right? And most people do. And so if you're asking these loaded questions, you're getting to know them in a way that you know what their time constraints are and their concerns are. And so now you can tie in how Propel and mopping a patient, the micro-osteoperforations, how VPro5, how accelerated treatment really is the ticket for them, and how the thing that they thought they weren't able to achieve or were really struggling with, you know, gosh, I don't want to do a year in braces, and are you kidding me? I just can't imagine being in treatment that long, which are all real concerns. I mean, I just finished my treatment. I'll share with you in a minute, here in a minute, how quickly I was able to complete treatment. I can tell you, if you told me it was a year, even though I know the health benefits and the benefits to my smile, it becomes a real hurdle for people to accept. So I love making connections between what motivates them and how we're able to do that with our technology, and that's what the consult is all about. You know, I think this is a way for our team really, when we train them, just one more moment on this, when we really train this well, and our team can do this as well, it comes across as this organized flow that doesn't come off scripted, and our patients can sense that, and it really comes off as, hey, we want to get to know you so we can really make sure that our treatment is meeting your needs the best way possible. And we've thought this through, and that's why we've invested in acceleration. That's why we want to be the practice that is doing things differently, while the rest are maybe not wanting to make that step into providing Propel. So these are the 2 concerns that we want to address. All right. One of the things that we've trained our team to have a lot of confidence in is to try to always set the tone for what we do different, and why, you know, if you're not really explaining what we do different and how we are a different type of practice and how we've set ourselves to try to be a leader, then there's no reason to choose your practice, right? So that's why we really spend a lot of time with that. We tie those with their benefits to them, why they're faster treatment times, less appointments, it's more predictable. That's another thing too, when we're talking about, and I know that brackets and wires, we get a little bit more predictability in them because, you know, they're attached, they're very rigid, and then they don't have to worry about, you know, tracking. And I will tell you, with clear aligner therapy, when we are using Propel, our tracking is so much nicer. The spacing, the next to none, you just see your teeth move much more predictably, and so that's a huge benefit. That is not really an acceleration related benefit. It's just the quality of the end result is just dialed in better for us. You know, when we're using terminology, this kind of ties into less is more here. We don't need to get into all the science of the patient, doesn't really drive that. I would really steer them towards, hey, we're using some methods to stimulate healing, improve accelerate the healing time of your jaw, so that way your teeth don't have to fight so much through the bone. We want to create an environment that is less resistant to the movement that we want to achieve. So those are all things that we say that are not getting into, hey, we're gonna stick a device in between the roots of your teeth and cause you to bleed, and you're going to need to be numb. You know, we don't want to dive into that when we're talking about a consultation. Use terms that are softer and kind of lessen the energy that might be perceived and the pain that might be perceived from that. All right. So we're going to get into a little bit here how the consultation in our office kind of flows, and as far as the records that are needed and what that really turns into for us. So we want to have a lot of really nice records, so that way we can tie in the types of movements we're going to need to achieve during this acceleration treatment. And then we also allows us to create awareness by educating them on what the patient has, that they existing conditions they weren't even aware of. And so I think if we're not really great at taking photos before, during, and even after all of our treatments, especially ones that are cosmetically driven and orthodontically driven, I think we're missing a great opportunity there for encouraging our patients and enlightening them all at the same time. Scans, I mean, I think most practices are aware of the scanning devices that are available. Here you'll see in this is actually a picture of our office, by the way. Most of the photos here are actually taken in our practice. But this is Amanda, our Invisalign coordinator, using one of the CEREC machines to scan a patient there, and you can see how we use those to have the dialogue with the patient on what's needed. The notes, obviously, we want to make sure that there's a great prescription that is put in layman's terms too, because I want the patient to hear what we are going to try to achieve for them and what we're going after, and then definitely be reiterating their chief concern, so that way they feel like they're really heard. I feel like a lot of times if I'm in a hurry, I can have a tendency to have a patient tell me they have a concern about this tooth, and I see the obvious problem over there, and so I start talking about, hey, I want to move this tooth, and they really weren't concerned about it, and now I've lost the connection that I could have had before. So I think that's really important to know that, and the team to know that, and really convey that across the board, so you're really addressing the patient's chief concern. And then, really writing down some compliancy factors. So, if you know that you're going to have some issues with compliance, and they've kind of enlightened us on that, we got to write those down and really give them some more encouragement on things that will help them with that. And obviously, accelerated treatment is going to be one of the largest benefits to overcome that hurdle of patient compliance. I wouldn't say it erases it, but it does make a drastic difference in our practice. Something that we all probably got a few questions over is billing, and is there any way to bill for Propel? And we have some methods that we've used successfully to do this, and we want to set the expectations for our patients that it's not every time it's not going to be approved, and it's not just we submit it and it's going to be a-okay and they'll accept it and pay us. So we don't want to create an issue with our patients getting frustrated that an insurance didn't pay us. I think we all probably have had those experiences before, and they're not pleasant. So I think setting an expectation that we're going to do our very best for them. We'll do some predeterminations, and we'll submit them with a very clear description. So here's what our practice does, and we've had very good success with this. Some notes to this though. The ADA code we use is a 7320, and we use an explanation, and we use a very clear documentation. This allows us to call it an alveoloplasty, contouring and changing the bone, and we have had great success with insurances paying on this. Many plans will cover it. You have to do it as a standalone procedure. They don't cover it if you happen to have done, let's say fillings that day or any other procedure that day. It's something that they will kick out. So that's good to know if you're wanting to use this code. Like I said, you can tap into the patient's general benefits, and we found great success. It was a wonderful recommendation by, I think, our Propel rep there. So there are so many different ways to bill for acceleration, and I think that everybody just has to make the decision that really suits them the best. So I don't really have, I'll tell you what we do, and we obviously, you can see here, in this slide, we use an one inclusive cost. and we do itemize the billing for transparency, but we do an all-inclusive cost, and then we present the financing options. But if you have a method that works for you, then it has been great. The idea, if you're kind of looking, okay, what should I do? I have, the reason I think the one inclusive cost works well is it'll set you apart, I think, a little bit from the nickel and diming aspect. So it doesn't come across as, hey, here's all of your options and choose your options and put it all together, and now you've got a very complex result and cost there. Plus, I think there's something really nice that I want our patients to have the best experience every time, and acceleration to me is really part of that. And so if I charge them $500, let's say, for Propel, and they choose not to, and I'm kind of bummed because, man, I really wish they would have done that. It's going to make treatment so much more fluid and much better experience for them, and they just didn't, for whatever reason, we didn't connect. The rapport and the communication wasn't there. They didn't really buy it. For whatever reason, they didn't see the $500 as necessary. I know I'd feel really bummed about their decision not to do that. And this way, I can charge a fee that I feel is fair for everything to be included. And now I don't have to be concerned about a patient not doing what I feel is going to give them the best. And as your parents probably have said to you before, who knows best, right? Your parents, if you got the experience, they know best. And I'd say as dentists, we have the experience, we know best here, and that's kind of where that one inclusive cost allows us to do that. So some considerations and thoughts for the process of implementation and how that looks. In our practices, the way we've done it, there's definitely, like I said before, I'm not trying to say that our way is the only way, and this one seems to have worked well for us, and it's still something we are always adapting, but with hundreds of treatments under the belt here, this seems to be working pretty well for us. So this is how we implement the Propel process. So steps here, we use chlorhexidine rinse. We use it 2 times for about a minute each. That way we're really lowering the bacteria count. We obviously don't want to see any infections start to rise from doing this, and I've yet to see that. So this seems to be very effective and plenty substantial for preventing an infection. We use local anesthetic. So obviously you can use topicals or strong topical anesthetic, and that's how we originally started providing Propel. So we would use a really strong topical. We would give minutes for it to set in, and it did a great job with the tissue. It did not do a great job at anesthetizing the bone. And when you're going to be putting pressure in the bone and causing some microfracturing of the cortical plate, you're obviously going to cause pressure to be exerted on the roots and the ligaments. So that pressure is what they will sense, or some people will sense. And so now you've caused some pain, and even though your topical is fully effective. So I feel like, man, I don't want anybody to feel anything. So that's kind of where we did switch gears, and now we do local. We do a little amount, and we set them up for this. So we let them know that, hey, you're going to be a little numb, but that's because we want you to not feel a thing. And then we go ahead and we give them half carpule of carbocaine do the infraorbital, and then a mental injection, another half carpule on each site. And so we split that up. They're not going to be numb forever here. And then we use a little bit of septicaine just to help infiltrate in a few areas afterwards. That way we know that those are going to be fully numb, and we don't have to worry about as much hemorrhage too, because the epinephrine that's in the septicaine. I think we'll go ahead and take a split to our video that shows myself getting some anesthetic here. So there you go, you can see me, and this is Kelsey, and one of our hygienists. She's going to give me anesthetic for Propel. I know it's probably a little choppy. We tried this earlier, and I think it worked. It was just maybe a little choppy, but you can see the mental frame in there. And these injections work well. They really get most of the areas you're going to probably want to Propel anyways, and pretty quick too. So I didn't feel a thing. She did a phenomenal job on that. So we'll go ahead and go back to our presentation here. All right. So we'll continue the mopping process here. So in order to determine where we want to propel, I like to palpate the area, look at some x-rays, make certain I know where those roots are going, and make sure that I'm obviously going to try to dodge those as I propel. The other decision you're going to want to make is which areas to propel, and so that gets into the where exactly am I going to dimple the tissue. And you'll see if I'm trying to get intrusion of the anterior 6 and lower anterior 6, upper anterior 6, it really is beneficial to go ahead and dimple the upper arch, double propel in between the roots from distal of canine to distal of canine. I've done that successfully. I've got some cases I'll show you where I've done that. We get really good results there. And then I single dimple the lower. The reason we single the lower, by the way, distal of canine to distal of canine, is not because double wouldn't work. It's just I only want to penetrate the connective tissue. So if you get outside of that area, you're going to get into the mucosa, and it gets a little messy. As far as you'll get a little bit of shredding or a little bit of tearing of the tissue, and so the healing time is going to be a little more painful and challenging. So with the single, I can really find a spot there on the lower that I don't have to worry about causing some damage to the mucosa. That's going to take a little more healing time there for the patient. And then if you got a really extreme movement, yeah, I have used a triple dimpling before. Now, there's something to be said here too for being strategic about which areas you want to go ahead and use propel. So if you need some teeth that are going to be anchors in your movement, it would obviously make sense to not propel around that site. So looking at your clean check, if you're using Invisalign, or really knowing your case if you're doing orthodontic movement with braces, that you want to not propel maybe the teeth that you're going to want to stay put, because they're going to be ones that are going to help accelerate the other teeth that you did propel. So that's a good thing to note there. And if you're wondering earlier, right, I showed you the video of the anesthetic being given to myself. If you're wondering who gave myself propel, I did. So this is a little interesting, right? You're going to perform propel on yourself. I really wanted to know, I've done hundreds of cases, and I was really, really curious about what this felt like, what it felt like to be numb that much, what it felt like to feel the device enter the tissue and the bone, and get an insight onto what my patients were going through, so that way I'd feel confident about my recommendations and what I was saying were going to be their side effects, if any. And so this really allowed me to do that in a way that was kind of fun, unique. The team kind of thought was pretty funny. I think here you'll see I get to have a little bit of fun with seeing how that engages the bone here. You can see I'm really working it in on that. It was really kind of hard to get enough force too, by the way, on yourself. It's a lot easier to do it on a patient than on yourself. But there you go, no hands. So the device is there in the cortical plate, worked well, and obviously causing a little bit of micro injury, but having a little bit of fun while we're doing it. So, all right, so go back here. All right. We'll go ahead and switch gears to the vPro 5 and how we implement that in our practice. So with vPro 5, one of the best things about the vPro 5 is it's so easy to explain to our patients, and giving them a confidence in a little device that they put in and they vibrate, and it's charged by something they already probably have at home, and that's a cell phone charger. So it's just a simple thing to do. We recommend twice per day, and then obviously the benefits are the comfort of the fit of this device. It can be used anywhere. We have learned from experience to not let the patients use it in the shower. So it sounds like a great idea, right? Brush and floss in the shower, save yourself time. Why not do the same thing with the vPro 5? don't do the same thing with VPro 5. It will not survive, and you will need to buy a new one. So I would not recommend that. You can definitely use it before bed. Obviously, it's a fantastic time for our patients to do that, or watching TV or driving to work. Those are great ones. So the maintenance of it, very easy. Just rinse and detach that mouthpiece that comes off there for the patient. All right, so we've got about 15 minutes here to cover some clinical examples, and I think this is going to be the part where hopefully is engaging, and we have some questions and inspires you about what is really happening when we're talking about acceleration. One thing I wanted to hit on that I didn't really address, and I had it in some notes here in the next few slides to discuss, but I think right now is a good time. So when do we change trays, and what time period do you recommend for tray change? And it really comes down to the type of movements that we're going to want to achieve, right? So if we're dealing with some very difficult movements like root torquing, then you're gonna have to have a tray that is working on that tooth for maybe a little bit longer than if we're doing simple crown tips and maybe rotations of large teeth like 8 or 9. Those type of movements are going to be much more readily achievable with 3 to 4 day tray changes rather than the torquing of the roots and things like that, the difficult stuff. So what I tell patients, and a good way to do this with Invisalign, is that, or with any clear aligner therapy, by the way, I know I've said Invisalign, I'm an Invisalign provider, I can't get away from it, but there's obviously other options out there. But any clear aligner therapy, just want to recommend that you tell the patient to really get a sense of how the trays fit, and tell them that, hey, we give you a guideline on when to change the tray, but you're an adult, or you're responsible for the result here. So really make certain that you gauge that. So if you go to switch to your next tray and it just doesn't fit, don't just keep moving on. Be honest with yourself, right? Did you have a weekend where you didn't have the tray in very often and you weren't very compliant? That'd be a great time to give the patient an encouragement that they can be their own gauge on how long they wear those trays. That was my experience with Invisalign. That was one of the best takeaways was, hey, I don't have to wear this tray 3 days because my schedule says and switch. I can wear it 3, 4, 5 days if I need to, if I'm out of town or on vacation. So those are great little things to think about if you're talking to your patient about tray change periods. I know that that's a real common question. It's always a common question I've had when it comes to, okay, how quickly can we move teeth? So here's the before and after for this patient. You can see we've got a deep bite. We've got some lingually tipped 8 and 9, pretty drastically there, full crossbite. Or actually, I don't know if they weren't full crossbite. I think here we go. No, they weren't. They were just super and a very large deep bite. A lot of crowding happening here. And as you can tell, we were able to do some pretty impressive for him, where we expanded the arch, drastic improvement on the deep bite, and kind of dialed things in there. And this was done pretty excitingly in 3.5 months. So he changed his trays out every 3 days, and we were able to get this achieved in 3.5 months. So pretty cool. He used Propel and VPro 5. All right, this lovely lady, she had those front 2 teeth bugging her, as you could probably bet would. They were pretty severely rotated, and there's a lot else going on here, so we'll look at that. Oops, there we go. A lot of crowding, right? So tremendous amount of crowding, and some issues with some pretty severe rotations. Even that lower left canine, number 22, pretty severely out of alignment there. So we propelled VPro 5 on this patient, and our total time in treatment was just over a year. She opted to change trays out at 5 days, and we thought that was a better solution for how much rotations we needed here. And so that was the result that we got there in just over a year. All right, so our next patient here has a deep bite, and I think we've got a lot of patients that have that. By the way, as far as new patients in our practice, when I see a deep bite with incisal wear, It's one of the first things I want to talk about. You know, it's something that is ignored a lot, I think. It's a huge opportunity for the private practice to say, yeah, I know maybe your grandparents had to deal with significant wear to those teeth that were out of alignment, but you know, have you heard of an opportunity to not have to deal with that? And by the way, you thought it was going to take 1.5 to 2 years. It's going to be much quicker than that. That discussion really opens the door. Would you like me to tell you about that? And you'll be amazed. Patients will go, yeah, well, talk to me about that. What is that? Why is that so worn? And I'm 27 years old. I don't get that. And so that's what we get to discuss when we take proper photos and show them the condition they have. But this lady right here, we were able to, you can see that lower curve of speed there, how we were able to level that off and get a much better bite relationship here. That was done in 4 months. And so that was just Propel, by the way, with her. And we used 5-day tray changes there to achieve that. This one has some rotations. So this has quite a bit of crowding in the anterior. We'll go to the close-up here so you can see before and after there. But some rotations and tipping, some minor crowding. But I've had patients like this come to my practice and say that they've been told that they couldn't do Invisalign. And so it's kind of shocking, but I'm sure a lot of people who have provided clear aligner therapy have heard that before or have seen consultations that have said similar things to them. Hey, I told I wasn't a candidate, and they look similar to this. And I'm going, golly, you're not only a candidate, but I think this could be done really quickly because we have some, you know, mild to moderate crowding going on. And I think if we expand those arches and give some more room to the circumference of your arch, give you more U-shaped arch, we're gonna really find some room here and get those teeth in the right position. And so this one was a great example of an acceleration treatment for that. And that was accomplished in 2.5 months. So 2.5 months with Propel and V Pro 5. She obviously was highly motivated. We told her that 3 days would work here, but you're gonna have to really make sure you hit that 22-hour mark with your tray work. She did, so good for her. All right, here is another patient with some lower crowding for sure, with some pretty significant rotations of those canines out of alignment. We were able to correct that in 6 months for this patient. He needed 7-day tray changes because of those canines being so far out of alignment there and creating more room for that. I knew it would take a little bit longer for that. You might recognize this guy here. That would be me. This is my alignment progress. You wouldn't believe it, but we don't have a very good before photo. Isn't that crazy? I'm sitting here talking about how important it is to get before photos of myself. I didn't even get a very good before photo. But you can see my diastema is fully closed, and this treatment was 57 days. So very quick. There's a quick view of what the photo I actually took on the right. Just took tonight, so you can see just got the buttons off, and very, very pleased with my bite now. I don't have a bite photo, I'm sorry, but I can just trust me, it feels great. So I was able to get a much nicer bite. All right, that gets to the end of what I had clinically to show you there, and I obviously want to open the floor to some questions and discuss what might work for you guys. And so I'm going to go ahead and look at some of these here, okay, and give you some answers to these questions. All right, I had a patient here that I have, okay, this is from, I'm gonna butcher your name and I'm so sorry, but it was Nastya. You had a question about a patient that maybe was sick after MOPS. And you know, I would probably have to say that I would find that unrelated. I'd have to go back and look at the exact number, but that doesn't really matter. But I've done probably 400 or 500 treatments of Propel, and I've not yet to see anybody have a sickness from that. So I don't think that was related, and I think you could probably with confidence tell your patient, I'm pretty certain that that would not be related to that procedure. Let's see here. Oh, I had a question about Omnican over Tero. So that's a kind of a general question, but I like that. So they both obviously are effective. Omnicam and iTero both are great at imaging the arch for providing all sorts of appliances, especially Invisalign. You know, the iTero I prefer for speed and quality of the impression for Invisalign. Plus, it has a built-in simulation. So we have both, and I do kind of lean towards the iTero. I will tell you, we use the Omnicam when we need to. So, all right. All right, there's a question there. So use local anesthetic without epinephrine, right? So yes, we do use carbocaine without epinephrine. And then we do use Septicane there to follow up a little bit as we infiltrate, just to make certain that the sites where we didn't do the block, just to make certain that the block worked. And so, you know, under 8 and 9, where hopefully the infraorbital block worked with your carbocaine, we just want to verify that, and it also gives you a benefit of not having as much hemorrhage during the propel process. Great question for that. Yes. Okay. So this is from Lance Robbins. He had a question about the lady that took just over a year. Did I propel more than once? And actually we did. So when it takes past about 6 months, we would like to propel that patient again so we continue to see the same acceleration that we were getting in the first 6 months. So yeah, I'd say anytime you're approaching that 6-month time period and you know you're going to be months after that, I would recommend propelling again. Right. All right, this is from Sarah Richmond. Are you using the regular aligner velocity or do you modify it at all? I tend to go half speed treatments and have them go for 3 days. I'm sorry, I'm not sure I understand the question there. I'm sorry. Are you using regular aligner velocity or do you modify it at all? I usually, maybe you're asking how often the 3 days, do I go 3 days, 5 days, 7 days? And we use variability based off of what type of movements we're trying to achieve. So if we're looking for just basic crown tips, that 3 day is probably going to work well. We would recommend that to our patient, and then we would have them use some wisdom on how those aligners are fitting to go ahead and decide if they can stick to the 3 days or they need to give themselves another day or so. Great question here. So this is from Keith Schwartz. He said, I just received my Propel and I have a few cases lined up to start as soon as I receive the aligners. How much time should I schedule and what sequence is best? Also, what technique do you recommend for mom? So I recommend using the handheld device. As you can see, I was using it on myself. The time frame I would recommend is going to be, you know, if you're just starting out, give yourself a few hours. I know because you got the delivery, you got the numbing, you got the Propel. And the reason I said is you don't want it to be rushed and feel like you're not really getting confidence in providing the service. I'd say in our practice, we pretty much can nail it in about an hour now, but it didn't start there. It definitely started more towards the hour and a half, the 2 hour time frame. And so, you know, with the help of hygiene numbing for me and, you know, the speed of that handheld Propel device, those really are going to allow you to cut down on the time it takes to deliver Propel. But I think, you know, make it a good experience for yourself, your team, your patients, give them confidence, and you'll gain confidence yourself. I'd shoot for maybe a couple hours my first time. Then you know, if it goes really well and you have plenty of extra time, next time it's an hour and a half, right? So great question. Okay, great question. Sarah had a question, Sarah Richmond had a question. I seem to always need to propel through the maxillary or mandibular frenum. Any advice on how to get through that tissue or how to avoid it? Well, I think that's a great point. I don't actually use that site at all. I know that there's some pretty decent studies that show you get the effect of Propel for about a 10 millimeter radius around the site that you propel. And so if you're getting just distal to 8 and just distal to 9, right there in the middle where you're going to obviously be getting close to the nasopalatine canal and that frenum, I would avoid that area. Same thing with that lower interior. It gets a little messy there, and you're really not getting the benefit that I think you're hoping to get. So I'd say I'd go away from that. It's a good question about tracking with patients that are less compliant, and absolutely, you know, this I think of myself. If I'm being honest, I don't think I hit 22 hours except for the first week maybe. But so I got my trays seemed to fit well. I did use Chewies. I did use the VPRO 5, and I was pretty good at making sure I wore them 17, 18 hours a day. But there were some days on the weekends, you know, time slips away from yourself and you realize that you didn't have them in as long as you should have. So absolutely. Clark, I wanted to answer your question there, man. I don't know if I understand it. As you said, what is your drill bit protocol? And I'm not sure I understand it. We put it on there at the beginning of the appointment, the tip. After it's used, we dispose of that in the sharps container. So maybe that's what you're asking. That's a great question too. I like that. So Sarah had another question there. Do you deliver the aligners and Propel on the first visit? And so at the very beginning of Invisalign, sorry, at the delivery, we would usually Propel the patient at that visit. But there's been other times where, like, let's say they come in for fillings and we're not using their insurance, so we're not worried about that code being rejected. It's a great time if they're already numb, right, to go ahead and provide Propel. We just did that this week. We had a patient, she loved that idea. She's like, I'm already numb. And I'm like, yes, perfect. Let's do Propel now. And she didn't have to be numbed again. So, but typically, no, we do it when we deliver the Invisalign. And yes, we are propelling on the first visit there. I had a patient here, or a doctor here said, Nastia had a question about how do you decide to use VPRO only or MOPS or both? And we propel everyone that's going to be somewhere around 15 trays or less. We do start to get in to the VPRO 5, especially if we're dealing with a deep bite, or we know we're going to have a longer treatment time, and we need to have that activity just last longer for us, the acceleration last longer. So we don't use VPRO 5 on every treatment. I would say use some judgment there and try to determine what the patient's needs are. And, you know, I think it's maybe a little overkill for 10 trays, but especially if you're just dealing with some basic, you know, tipping. But you get into more complex deep bite movements, arch expansions, things that start getting into 4, and it sounds crazy, right? 4 or 6 months. That's like long treatment these days, right? 4 to 6 months in our office is like a long Invisalign treatment. It's kind of getting hard for me to, I mean, I'm getting more used to it, but it's hard to wrap your mind around that being a long treatment. But 4 to 6 months, then yeah, VPRO 5 becomes a very beneficial device. And this is a good question. You know, Nastia asked if we keep the tip if you're going to use it again for the patient. We don't. Gosh, I think it's just probably the fact that they don't recommend that it be sterilized. They have plastic on them, and I don't think it's sterilizable anyways. So keeping that tip around, it's just not a cost savings that I think is really worth the effort there. You know, you're charging a considerable amount for the treatment. I think you maybe can build that in. We do charge a little bit more for treatments that take longer. So that's a good question that maybe is answered with how do we make it profitable or beneficial to the practice when we need to use Propel again. So, you know, you're talking about a device that's roughly the tip's $100 some odd. So we're charging an extra $1,000 or more for longer treatment. So we cover that with the larger price on that. Okay, that's a good question, Clark. I like that. Do you include Vivera retainers in your treatment cost too? And do you use a informed consent? So the first question, we do include the retainers. It goes back to the same philosophy of a patient experience, and I feel like there's, and I could be wrong, there could be other ones that are seem to be work better for your patients, but the Vivera retainers seem to work phenomenal. And obviously it's already integrated in with Invisalign, so it seems to work well for people that are using that. But I would recommend, and we include it, that way, once again, it's everybody gets the best experience. And even though retention is the patient's responsibility, as you already probably have witnessed, they want to make it our responsibility. And so this way I have a little bit more assurance that I have done everything I can to not just get them in the right position orthodontically, but to try to help them stay there. And then the other question was something about, oh yeah, informed consent. You know, I don't use any informed consent for breaking off a drill tip. You know, we're not going very deep. It hasn't happened to me. I don't think it probably ever will. If it did, it is so shallow. I don't think I would have too much trouble going after that. But I mean, obviously, I don't think that'll ever occur. It's a good question though. But those tips are very strong. I think Propel would probably be able to back me up with that and say that there's probably not been an experience where that's happened. All right, just make sure I finish up the final few questions here. Okay, yeah, what are your post-Propel patient instructions? So we encourage them to use warm salt water. I will tell you, I was a bad patient. I didn't do any warm salt water. And so that's another great thing about the experience of having a procedure done on yourself. I'm not saying everybody else could do it, but you can maybe, I'm going to speak really honest and candid with you about my experience, whereas a patient might hide it from you. And I didn't do anything special other than, you know, just basic mouth rinses. I think I used you know, Crest Pro Health, and made sure I just brushed my teeth regularly and kept as clean as I could. But it heals so fast that I don't really think you need to be giving them a whole list of you know, post-op instructions other than maybe warm salt water if needed, but make sure you encourage them to maybe use a mouth rinse. It'll be good. Yeah, Keith Schwartz had a good question here. Do you ever start mop after the patient has already been wearing the aligners? Well, since all of our patients start with Propel, then no, we obviously we've already started it. But I think that's a great option if you already have patients that are in it to make them aware of it. If you're starting in Propel, matter of fact, back when we started, we did offer it, and I believe we charged $500 or something like that to say, hey, if you want to accelerate treatment at this point, and you've been in treatment for a while, or you've had a number of refinements, and we're trying to get to the right result for you, maybe this acceleration would help achieve that for you. Would you have for that? I think that's a good option. That's a good question. So Clark Hunstad, how many perforations? I think I've said it. That's a good question. Every question. There's a lot of good questions. All right. So how many perforations do you typically make with one case and one tip? So it just depends. It varies based on the patient. I'd say the most, let's say we're doing a deep bite and the anterior sixth and they upper and lower is pretty overlapping, deep overbite. We would be doing a double dimple distal of canine to distal of canine. So the math there would be roughly 16 on the top and then roughly 8 on the bottom. So you might be max 24 to 26. You know, you're plenty safe on the number of perforations there. Awesome, good question here about the treatment times and how do you really make that, how do you make less chair time? So we send them home with more aligners, and we're able to give them, like, we base it off of when they need IPR, and so we can kind of plan the treatment around that. And so yeah, we instead of giving, like, you know, traditionally when we started Invisalign, you might do 8 aligners and see them every, you know, 2 to 4 months, something like that, depending on how long you had to wear them. This, we are able to go ahead and see them back at a rate that doesn't basically you don't waste a ton of chair time this way. So I think shooting for 2 to 3 months, you know, you might only see them once or twice, which is kind of weird, right? I mean, it's different providing care to somebody and going, hey, we're going to see you like once in treatment. By the way, there's some really cool software that I've looked at and looking at currently. I don't know if I will use it to its fullest at this point, but there is stuff out there that is being developed to allow us to track patients at home with their cell phone. So I mean, it's wild. I've already seen a demonstration. So pretty cool. And I've kind of forgotten the name right now, but I mean, things are really changing and exciting for us dentists in this that are willing to jump into acceleration treatment. You're going to be able to monitor your patient. They're going to be able to have kind of fun tracking and seeing the results with something they have in their pocket. So talk about win-win. You know, they don't even have to come in. Let's say they live an hour and a half away, or we have a lot of patients that live quite a ways away, and man, that's pretty slick. Right. All right, so there was a statement here from, or a question here from Nasia. If your patient has a metal allergy, how do you propel? And that's a good question about, metal allergy. I've never even had that come up. So that's maybe a question I'll have to kick off to propel and see if there's anybody that's had an issue with a metal allergy. Because I've not really, I'll be honest with you, I've not really considered that. And I guess that could be a problem. I guess that where my thought comes in is it's not something, you know, like the nickel allergy we see with some of the PFM crowns. It's when it sits right there next to the tissue for, you know, hours and days and years that you see the reaction of the tissue, and the propel device is in for literally, I mean, 30 seconds or, well, probably 15, 20 seconds a site. So you're not dealing with a whole lot of time with it touching the tissue. So thanks for all the questions there, guys. There was a lot of good questions that came in, and thanks for listening to me for the last hour. And hopefully I didn't bore you too much, and you got some good insights into propel. And I wish you all the best, and happy propelling.